Antimicrobial resistance, or AMR, is what happens when very important medicines, such as antibiotics, stop working when needed. World Health Organization has listed AMR as one of the urgent health challenges for the next decade. AMR occurs when bacteria, viruses, fungi and parasites change over time and no longer respond to medicines, making infections harder to treat, leading to worse health outcomes.
Some antibiotics work by killing bacteria. Other antibiotics work by stopping them growing and multiplying. Antibiotic resistance happens when bacteria become resistant to antibiotics. The bacteria find ways to adapt and evolve when they're exposed to antibiotics. This then means that these bacteria are able to go on and infect other people and become harder to treat than non-resistant bacteria.
Globally, at least 700,000 people die each year due to diseases that have become resistant to medication. Some estimates suggest that if we don't stop AMR, it will kill 10 million people per year globally by the year 2050. And that's more than cancer and diabetes combined. The rise in AMR is caused by the overuse and misuse of these important medicines.
Preventing infections is key. Regularly wash your hands, avoid contact with sick people, and ensure your vaccinations are up to date. If you do need antibiotics, it's important not to misuse them. Don't be tempted to stop taking antibiotics if you feel better. Take them as your doctor prescribes, and your prescription will tell you exactly how long. Only take antibiotics a health professional has prescribed for you. Except when an antibiotic is not needed. For example, they can't help you if you have a common cold. Don't keep leftover antibiotics to use later. Don't flush them down the toilet or sink. Hand any unused antibiotics you have to your pharmacist for disposal.